Imagine this. You are telling a story at dinner, everyone is laughing, and then suddenly the name of your neighbor, a person you have known for 20 years, is gone. You stare at the table, searching, embarrassed, heart beating a little faster. Later that week, you drive to the store with one simple thing on your list. You walk in, wander the aisles, pay, drive home, and realize you forgot the only item you went there for. Most people around you shrug and say, "That is old age. That is what happens." But what if they are wrong? What if a big part of that fog, that slowness, that lost word on the tip of your tongue is not your age at all, but something sitting quietly in your pillbox? Tonight, you're going to hear about 7 types of medications that can quietly steal your memory and what you can do about it. For many seniors, memory worries do not start with a dramatic event. They start with small slips. Misplacing keys in new places, forgetting an appointment you never used to miss, needing to reread the same paragraph twice. Those moments bring a deep fear. You wonder, is this the beginning of something permanent? Am I losing myself? Here is the truth no one explains clearly enough. There are many causes of memory problems. Some are from diseases of the brain. Some are from lifestyle, like poor sleep, high stress, or lack of mental stimulation. And some come from a source that is often ignored: your medications. As people pass 50, 60, 70, the number of prescriptions usually climbs. A pill for blood pressure, another for cholesterol, one for sleep, one for reflux. Add a pill for allergies in spring, something for pain in winter, and a supplement or two. It is common for an older adult to swallow 5, 6, 7 different pills in one day. This is called polypharmacy, many drugs at once. Each pill does something helpful, or it would not have been prescribed. But each pill also touches the delicate chemistry of your brain. Sometimes that chemistry is changed in ways that interfere with how you think, learn, and remember. Your brain uses tiny messengers called neurotransmitters, so its cells can talk to each other. One of the most important for memory and learning is acetylcholine. You can think of it as your memory messenger. When you want to remember a name, or where you parked, or the next step in a recipe, acetylcholine helps your brain cells pass that information along quickly. Several popular medication families blunt, block, or drain this messenger. When you take one of those drugs, you may feel a little sleepy, a little foggy, a little slowed down. When you take 3, 4, or 5 of them together over months and years, that effect adds up. You see it as forgetting names, losing track of conversations, struggling to focus. But inside, it is as if someone has turned down the volume on the circuits that used to fire quickly and clearly. The hopeful news is this: when the problem is caused or worsened by medication effects, it is often at least partly reversible. When the drug is reduced, switched, or stopped under medical guidance, many people notice that the fog lifts. The switchboard inside the brain wakes up again. To take advantage of that hope, you need to recognize which pills pose the greatest risk, what part of your brain they affect, and what safer options you can discuss with your doctor. Let us walk through 7 common medication traps, one by one. The first group is hiding on almost every pharmacy shelf. They are the older-style allergy and sleep medicines, the ones that promise to dry a runny nose or help you fall asleep fast. If you have ever taken something that said PM on the label or that contained diphenhydramine, there is a good chance you have met this family. Brand names change from country to country, but the effect is the same. You swallow the pill, you feel pleasantly drowsy, and you drift off. What most people never hear is this: the very reason these pills make you drowsy is that they are strongly anticholinergic. That means they block acetylcholine, your memory messenger. They pass easily into your brain, sit on the receptors that should be receiving that messenger, and shut them off. In the short term, that block is what makes you less alert, less wired, more able to sleep. In the longer term, when taken night after night, season after season, the block can show up as slower thinking, poorer attention, and weaker short-term recall. You might notice more of those moments where you walk into a room and have no idea why you came in. The good news is there are modern allergy medicines that were designed not to cross into the brain so easily. They focus on the nose and eyes, not on the memory centers. Their labels often say non-drowsy. They are not perfect, but they are a friendlier choice for your brain. For people who reach for an older antihistamine just to sleep, it is worth asking, is this really the best tool? There are many gentler sleep supports. A consistent bedtime, darker room, cooler temperature, brief evening stretching, and calming routines can make a surprising difference. Some people also do well with natural supports like magnesium in forms that cross into the brain more kindly, though even supplements should be discussed with a professional. The key idea is this. If you are taking something at night that makes you feel groggy the next morning, you are feeling the drug's work in your brain. Over time, that effect can stack up. Simply switching from an older sedating antihistamine to a newer non-drowsy one, or finding non-drug ways to ease sleep, can give your memory messenger room to work again. The second major trap comes from two groups of drugs that many seniors rely on daily. One is prescribed for anxiety and sleep. The other is prescribed for cholesterol and heart protection. Both can touch your memory in different ways. First, the calming pills. Names like diazepam, lorazepam, alprazolam, and others in that family belong to a group called benzodiazepines. Doctors often use them for intense anxiety, panic, or short-term insomnia. They work by boosting a natural calming chemical in the brain called GABA. When GABA activity rises, your brain activity slows. Racing thoughts quiet down. Muscles relax. You feel less on edge. That can be very helpful in a crisis. But when the brakes stay pressed down for weeks and months, your brain has trouble doing its other job, forming and storing new memories. Imagine trying to write a letter while someone is constantly dimming the lights in the room. You can still form letters, but slower, less clearly. Benzodiazepines can create a similar dimmed state in the parts of the brain that handle learning and recall. People who take them regularly often describe feeling detached, spaced out, or unable to recall parts of conversations or whole evenings. These medicines also carry a serious risk of dependence. Stopping them suddenly can be dangerous. Any change must be done slowly with a doctor who understands how to taper them. But if you are on one, it is reasonable to ask your prescriber whether there are safer long-term options to manage anxiety or sleep, including therapy, stress management techniques, and non-sedating medicines. Now, the cholesterol pills. Statins such as atorvastatin, simvastatin, and others have saved many lives by lowering harmful blood fats and reducing heart attacks and strokes. For many people, they are appropriate and necessary. But like any strong tool, they have trade-offs. Your brain is a hungry organ made largely of fat and cholesterol. It uses cholesterol to build and repair the insulating coating around nerve fibers, which speeds the signals that carry thoughts and memories. When overall cholesterol production is pushed very low for years, the brain may have less raw material to maintain that coating. On top of that, statins tend to lower levels of a nutrient called coenzyme Q10 throughout the body. This nutrient is crucial for making energy inside cells, including brain cells. When energy production falls, cells can struggle to keep up with tasks like forming and retrieving memories. People sometimes describe this as feeling slowed down or mentally tired, even when they have slept. Not everyone on statins will notice these effects, but enough people do that regulators have added warnings about possible memory changes. If you started a cholesterol drug and months later noticed new confusion or forgetfulness, it is worth gently asking your doctor if there is room to adjust the dose, change the type, or support your brain with added coenzyme Q10. The take-home message is not that these drugs are evil. It is that any medicine which calms the brain deeply or alters fat and energy supply can also touch your memory. Being aware gives you power to ask better questions and find balances that protect both your heart and your mind. Chronic pain and chronic heartburn are two of the most common complaints in older adults. No one wants to live with daily pain or burning in the chest, so it is natural to reach for relief. But some of the drugs used for these problems can cloud the mind if they become long-term habits. First, strong pain pills. Opioid medicines are often prescribed after surgery, for severe injuries, or for intense ongoing pain. They work on powerful receptors in the brain and spinal cord, lowering the feeling of pain and creating a sense of warmth and comfort. Used for a short time, in the right setting, they can be a blessing. Used for months and years, they change the way the brain works. The same receptors they activate for pain relief also play roles in attention, motivation, and learning. When they are constantly stimulated by a drug, the brain can become less responsive to normal signals. People living on long-term opioid therapy often describe feeling like they are moving through fog. It is harder to focus on a book, follow a conversation, or remember details. The world feels slightly distant, as if behind glass. Those are brain effects, not just body effects. Even milder pain relievers can have hidden costs when used every day for years. Some common anti-inflammatory drugs have been linked in studies to subtle changes in brain function, especially at high doses, though they are generally safer than opioids. When it comes to ongoing joint pain and stiffness, there are non-drug options that can decrease the need for pills. Gentle movement, strength training, weight loss where appropriate, heat and cold therapy, and evidence-supported natural compounds like turmeric extract or boswellia can all reduce inflammation. These should be used with guidance, especially if you are on blood thinners or other chronic medicines. Now, let us talk about stomach acid pills, especially proton pump inhibitors, often called PPIs. They are prescribed for reflux, ulcers, and chronic heartburn. Names differ, but their job is the same to cut down acid in your stomach. In the short term, turning down stomach acid can prevent burning and allow damaged tissue to heal. In the long term, when acid is kept very low day after day, your body struggles to fully extract certain nutrients from your food, especially vitamin B12. Vitamin B12 is crucial for your nerves. It helps build the protective coating around nerve fibers and supports the chemistry that keeps your brain alert and clear. When B12 runs low, people feel tired, unsteady, and mentally dull. They may become forgetful and moody. These changes can look a lot like dementia, but are often reversible when B12 is restored. If you have been on an acid-suppressing drug for many months, it is reasonable to ask your doctor whether you should have your B12 level checked. Sometimes, adjusting the dose, using the medicine for shorter periods, addressing the causes of reflux through diet and posture, and supporting the stomach in other ways can reduce the need for long-term acid suppression. The big idea is this: any medicine you take every day for years deserves to be re-examined now and then. Pain and reflux deserve relief, but so does your brain. With careful planning, it is often possible to reduce doses, use medicines in shorter bursts, or combine them with non-drug strategies so your mind stays as sharp as possible. Some medicines are meant to work far from the brain, on organs like the heart and bladder. Yet because of how they are built, they easily cross into the brain anyway. When they do, they can disturb memory and attention in ways that are easy to overlook. Consider certain blood pressure medicines called beta blockers. Their main job is to block the effect of stress hormones on your heart, slowing the rate and lowering the force of each beat. This helps reduce blood pressure and protects the heart from strain. Some beta blockers dissolve easily in fat. Because the brain is a very fatty organ, these drugs pass into it quite readily. Once inside, they can blunt chemicals involved in alertness and quick thinking. People taking them sometimes describe feeling slower, less motivated, or unable to find words as quickly as before. Other beta blockers are more water-friendly and have a harder time crossing into the brain. They still help the heart, but cause fewer thinking changes for many people. If you are on a heart pill and have noticed new mental sluggishness, it is worth asking your doctor whether your specific medicine is one that often affects the brain, and whether a different option could control your blood pressure without dimming your mind. Now look at the bladder. Overactive bladder and urgent frequent urination can be very distressing. No one likes to map every outing by toilet locations. To help, many doctors prescribe medicines designed to calm spasms in the bladder wall. These drugs work by blocking acetylcholine, the same memory messenger we spoke about earlier, but this time at receptors in the bladder muscle. The muscle relaxes, urgency eases, and people feel more in control. Unfortunately, the medication does not know the difference between a receptor in the bladder and a receptor in the brain. Many of these bladder pills are strongly anticholinergic throughout the body. They can cross into the brain and sit on memory receptors there. That means you may trade fewer bathroom trips for more confusion, more word-finding trouble, and slower thinking. For a senior already worried about independence, that trade can be costly. The hopeful news is that newer bladder medicines exist which act on different receptors and have a much lower impact on the brain. There are also non-drug strategies that can help, such as bladder training, pelvic floor physical therapy, and lifestyle adjustments. For both heart and bladder medicines, the message is the same. If a drug meant to act in your chest or pelvis seems to have changed how your mind feels, do not ignore that. It may not just be the passage of time. It may be the pill. Bring it up with your doctor calmly and clearly. Ask whether there are options that protect your organs without punishing your memory. Hearing about all these risks, many people decide to turn to herbs and supplements, believing that natural always means safe. But one plant in particular shows why that belief can be dangerous. St. John's wort is a yellow flowering herb often sold for low mood and mild depression. Some studies suggest it can help some people feel brighter. Because it is sold without a prescription, many assume it can be taken casually on top of whatever prescriptions they already use. Inside your liver, there is a powerful system of enzymes that acts like a sorting and shredding facility for chemicals. When a prescription drug enters the body, these enzymes help break it down and clear it at the right speed. If the enzymes work too slowly, the drug builds up to levels that are too high. If the enzymes work too fast, the drug disappears before it can do its job. St. John's wort strongly speeds up some of these enzymes. When you take it regularly on top of other medicines, your liver starts breaking those medicines down much faster than your doctor intended. That means your cholesterol pill, your blood thinner, your heart rhythm medicine, your anti-anxiety drug, or even some of the very pills we have talked about today may become suddenly weaker. Your blood pressure could climb, your heart condition could destabilize, your mood could crash. From the outside, it can look as if your prescription stopped working. In reality, the herb has pushed them out of your body faster than they can help you. This is not a gentle, harmless effect. In some cases, it can be life-threatening. This is why it is essential to treat herbs with the same respect as prescriptions. Always tell your doctor and pharmacist exactly what you are taking, including teas, powders, capsules, and oils. If they do not ask, you can still tell them. There are, however, safer natural supports for mood that do not play as harshly with liver enzymes. Saffron extract is one example that has shown promise in research for mild mood support without the same level of dangerous drug interactions. Even then, a professional should guide you. So where does this leave you? You now know about 7 major medication families and one powerful herb that can cloud your thinking. That knowledge is valuable, but only if you turn it into action. The next step is not to throw your pills away. It is to become the leader of your own medication review. Gather your prescription bottles. Write down every name, including over-the-counter products. Mark the ones that can affect memory and the ones that may clash with herbs. Then, bring that list to your doctor or pharmacist and have a calm but firm conversation about your clarity, your goals, and your options. You are not being difficult. You are protecting your brain. If you have been blaming every forgotten name and every foggy morning on your age, today you have seen another side of the story. Your memory is not only shaped by years, it is shaped by chemistry, by the pills you swallow, and by the choices you make with your health team. You now know that certain allergy pills, sleep aids, calmers, cholesterol drugs, pain relievers, stomach pills, heart medicines, bladder medicines, and even some herbs can dim the very circuits that make you you. That is serious, but it is also an opportunity. Start with one simple step. Lay out all your medicines on the table. Make a list. Bring it to your next appointment and ask, which of these could be hurting my memory? Is there a safer option for someone my age? If this message opened your eyes, share it with someone you love who takes many pills. Your mind, your stories, and your independence are worth protecting. You deserve to grow older with as much clarity, confidence, and sharpness as possible.